We're good. It's still working. So anyways, back in 2017, I actually published an article that did a literature review of all of the CAM options that were published in the literature related to people with bleeding disorders. And I'm happy to report that after it's been 5 years, there's actually more out there, which was a big surprise and a pleasant surprise to me. So as Rich mentioned, I am retired. I actually have been in the bleeding disorders community for more than 25 years. I ran a treatment center for 15 years or so. And then I spent more than 6 years working in the pharma doing education. So pain is my first love, as is aging, if you can believe it. Never thought that would fit in bleeding disorders, but it does. I'm a member of the MASAC Multidisciplinary Pain Task Force member, and so we're still working actively on pain issues related to bleeding disorders. So I have listed here some of the objectives. I'm going to actually skip the opioid, NSAID, and cannabis because I don't think we'll have time. I'm going to do a quick review, just so you know, and I know I'm speaking to the choir. Up to 76% of people have reported pain with bleeding disorders. And those who utilize prophylaxis actually report less pain as opposed to those who don't. And I think the message there is your treatment regimen is important. In 2012, at our national pain study, we found that 40 to 60% of people said that their pain was not well controlled, and this was confirmed in an additional study. This was Dr. Mako Johnson's presentation at World in 2016, and you'll notice it was the pain report based on treatment regimen. And as you'll notice that people who had the lowest pain report were on prophylaxis and followed by continuous prophy, and you see those pain levels have since increased. So the message here, if you're not hearing it or seeing it, is that treatment, regular treatment, ongoing prophylaxis is the way to go to manage your bleeding disorder, but also to help minimize pain. There's been studies that have identified the pain interference with people over the age of 18, but also in a second bullet, you'll see 18 to 30 years. At least 90% of young adults of that age group reported pain interference with their activities. And also the next slide, which was another reference, showed the age of being up to 36 years, with both male and female also had interference. I think what's interesting on the lower bullet is the pain interference based by age. And this makes perfect sense to me in that over 40 years of age have greater pain report or interference. This is typically the group that did not have the benefit of prophylaxis. And interestingly enough, I'm at another presentation, organization giving a presentation, and I reported this, and here was this young guy that had no idea that people over 40, for instance, did not have benefit of prophylaxis and have much worse joints as a result, and based on this study has worse pain. They also, with the hemophilia B hero study, that people with hemophilia B, even moderate, had poor health status. And there was also a study that I did with some of my colleagues that looked at 13 to 25-year-olds who actually reported that they started using pain medicine at 11 and a half years of age. This was just an incidental finding of a study I'm going to describe in a minute. But what it presented was more questions this is the group that should be on prophy, because that's the mainstay of therapy. And why are we dealing with pain at such a young age? So it raises more questions. Are we skipping prophy? Are we doing what we're supposed to be doing? Are we prophying properly? Is it being ordered in the right way? Should our trough levels be higher? So again, a lot more questions. And then in another study done in 2016, we found that there were ethnic disparities related to reports of pain, in that people of other cultures, such as African American and Asian, Pacific, and so forth, actually reported higher levels of chronic pain and lower physical scores than Caucasians. There was also a study done with women related to menstruation. This was done in England. They had 151 subjects, and at least 65% reported painful cycles and a higher prevalence of heavier bleeding and prolonged painful periods. And then the study that I was referring to that we did back in 2017 that actually looked at how a person experiences their pain, the young adult 13 to 25, what their perception is by their caregivers, such as their parents, and then what is the perception of pain by their providers or their treatment center. And what we found is that there was poor agreement amongst all three. What you'll notice in the bottom bullet is that the caregivers and patients had more agreement, but it was really only 29%, and that patients and providers had even less. So what this tells us is that the pain experience that people are having is still very personal, that it's not well understood, but it also, to me, always raises more questions, which is part of research, is could it be that providers are less in agreement because patients didn't want to tell them, because it might restrict their activities, or did they not want to tell their caregivers either, who might restrict them from, say, getting up and riding their bikes, as an example. So again, more research is needed. There was a perception of pain studied in people with hemophilia in England, and some of the main issues that came out is that most people feel that pain is considered normal, and that the themes of impact and managing and what influences pain were some of the issues that came out. And childhood was when they first remembered it, how it affected health and well-being, and that they are now starting to be able to recognize the difference between pain related to our acute bleeds and arthritic pain. They don't like pain scales, and of course there's research out there that says there's issues regarding those, and that they felt there was lack of empathy and understanding among healthcare providers who understood pain but thought their therapists, physical therapists, were helpful. They did recognize the value of talking about their impact of pain experiences, and which provided some support. But there still needs to be some better issues with psycho and social implications of chronic pain needs to be addressed. So you can see that this was more of a descriptive study, but it highlighted some of the key features, I think, which are endemic to all people with bleeding disorders. Just a review, we know that people with pain also have issues with depression. Up to 60% was reported, and they're less likely to complete high school or treat properly, which we know we need to address, and also have less social support, unemployed, or have more joint pain. Also, we know that anxiety plays a part in pain. And again, these are research studies that are only within the last 5 to 10 years. So I'm glad to report that we can actually say we're looking at it, but up to 67% of people report pain or anxiety, and that these anxiety scores were particularly noted among children and adolescents. But the other box at the bottom, which I thought was interesting, is that mothers of hemophilia children have greater anxiety and depression scores than the general population or the control group, and that their scores were actually associated with their children's own. So it really tells us that it's a family issue to manage this condition, as well as manage the painful experiences associated with it. Just an FYI, there was a study done that looked at women with hemophilia B and or men as well, and anxiety and depression seem to be more prevalent with women than men. Don't have the answer for that yet. But just in summary, that we recognize that they're all interconnected, and that there are significant physical and emotional problems that can interfere, and that we need to address all of this in a collective way, and that we still need more research. So again, if you're seeing any research studies out there that address this, join in, because the more we get, the more we know, the more we can manage it. So I'm just going to touch briefly on what the pain pathway is to help you understand that process. You'll notice that, say, if we have a bleed, say, as a knee joint, so it's right at the site, there is the ascending pain pathway that passes through the spinal cord up into the brain, where the brain interprets the pain experience and sends that message back down to the knee going, ouch, it hurts. So we have an opportunity all along this pathway to manage pain in a variety of ways, and that's what we're going to talk about now. So I'm going to talk about non-pharmacological treatment options, specifically known as CAM. And what you're looking at is my backyard out onto the Lake Erie this past winter. Was pretty awesome to see. And at night, I see the glow of Cleveland, but no buildings, just that hovering of light from the city. So complementary and alternative therapy, known as CAM, has been used in all populations. And in the general population, you can see up to 38%. And this is an old report back in 2008, and I believe that it's much higher. But people seek it out for a number of reasons. Some, they don't think the regular treatment that is being provided is not helpful. They want to limit pain medicines to avoid side effects. They want things to be more holistic. They want to be in control, or they feel that it's patient-centered. Either way, I think that there's an opportunity to explore these options with our treatment center providers to find out what might be the best combination as on a personal experience. So back in 2013, an Indian study, Dr. Jadhav actually looked at 160 severe Hem A patients, and you see up to 43% used CAM and continued to use it for more than 1 year. And this was done in 2013, and they felt they had some positive effects, such as reducing bleed frequency and managing pain. This is our national pain study, which started us on the pain journey with Michelle Whitcup and myself. And you'll see there's a whole list of different pain options, from physical therapy, pool to acupuncture, which was used for both acute and persistent pain. And in general, I find these numbers are low. But back then, we're talking how many years? 20 years now. I would love to replicate this exact study and see if those numbers are the same, because I do think that there's an increase. So what is the definition of CAM in general? Well, complementary therapy is used with conventional medicine. Alternative is used in place of, and integrative is the combination of both conventional and complementary medicine. So really, using a combination of both is the ideal way to go, and should be discussed with your treatment center approaching that. There are 4 particular domains. We're going to cover each one. I'm going to try to list all the different the therapies that are available. I may miss some, but I think I'm pretty complete, and I'm open if I miss one. So let me know. So we're going to start with mind body. These are typically with the brain holding control of your body symptoms, and you have an opportunity to have an impact in that. So we know that the brain interacts with all bodily functions. So here's a list of some that we're going to go through and the relative research related to it. So mind and body practices. Well, guess what? Yoga is out there, and the World Federation actually recommended it back in 2006. But in 2015, there were a couple of a small sample of boys that did try yoga and found that there was differences in quality of life and bleeding episodes and school absences. But recently in 2020, they actually identified Nastri and his team that a significant role of yoga in lessening the rate of bleedings and that non-attendance that was used in Iran. And then most recently in the pediatric psychology journal, it's recommended for people with bleeding disorders that it can improve quality of life with chronic medical conditions. Now, you're probably going to say, I can't do those positions, but everything can be modified. I can tell you that I can't do all those positions, and I don't have a bleeding disorder, but I can get better at it. And I think that there's an opportunity for you as well. And it includes improves flexibility and balance. Cognitive reframing is a way of kind of retraining your brain. Dr. Elander from England is well known in this particular modality, and he was able to discuss the use of it in reducing pain intensity, which improves quality of life and reducing negative thoughts. But recently, as 2021, so I was happy to see there was another study done more recently, but it's a small number that did show that with cognitive reframing that they had some improvement in their pain management scores, quality of life, emotional status, etc. So again, this cognitive reframing is an opportunity It does require a special therapist who understands that process and helps teach and walks you through it. So behavioral health is where it is at. You may have heard of biofeedback. It actually was talked about in many case studies very long ago, as far back as 1981, where you see 2 case studies. And for those of you who don't know what biofeedback is, it has to do with you're hooked up to a machine and you either listen to a tone where you try to lower your heart rate. So you're getting that instant feedback as a form of relaxation with deep breathing, but you get that instant feedback, and they measure blood pressure and so forth. So again, in 1984, there was a reported study that showed it reduced pain behaviors, but also most recently in 2006, they felt that biofeedback was help for specifically stabilizing the muscles. So in the most recent study, 2021, they recommend it for pain management and hemophilia as well. You're all familiar with distraction. There's a variety of ways, listening to music, watching TV, talking to somebody, a pet. The options are endless. And Dr. Elander did report in 2009 that it was helpful to reduce negative thoughts. And also he started a randomized controlled study in 2011 that looked at a DVD format that improved the use of distraction to manage pain. For those of you who may not remember, as recently as 2017, Dr. Dunn in Columbus, Ohio, actually did virtual reality glasses with children with a median age of 12. And what they did is they were looking at reducing pain and time with IV insertions, so getting blood draws and getting hooked up for factor infusions. And they found a really significant difference that these kids were totally distracted and immersed in the virtual reality glasses. And I think this is something that we could use more of as well. In fact, I read a really interesting study about guys involved, oh my God, I'm drawing a complete blank, in the war and who suffered burns, and they used virtual reality in a cold, looking at a cold environment to help reduce pain while they did dressing changes. So I think there's a lot more use that can be done here. You've all been familiar with relaxation and meditation. I think that there's a big opportunity here for our brain to control and manage this for ourselves. You'll see back in 1995, it was first discussed. It was with just a couple of patients, but they felt that it was helpful, actually not helpful. But in 1981, there was a case report by Dr. Varney, who did find with a small group of 3 that they had improvements in pain and sleep. And then he also reported on one case study where he felt that the pain intensity decreased as well as the analgesia that he took. But again, a most recent study, which I was happy to see in 2021, which a fairly large sample of 80 patients that were able to reduce their pain intensity and improve their belief in perception and pain acceptance with the use of meditation. So if you're not listening, I think this is an opportunity for growth and use to manage pain. You may have heard the term neuroplasticity. This typically is the body and the brain's response to that pain experience, but how it can reorganize and form new neural connections. One of the problems with chronic pain is they develop that pathway and it just seems to be a consistent, like a rut. It just keeps going on that same rut. And by working with a behavioral therapist, you change the brain's connections so that you change those pathways into new pathways, which then allows you to manage that pain in a different way. So in 2018, Valpin and his group found that the neurophysiology of chronic pain, with reconceptualizing it, helped to implement better effective physiotherapy and exercise and to reduce that maladaptive behavior. So I think, again, there's opportunities. You're all familiar with the word hypnosis. I'm not sure how everybody feels about it. When I was just in the last talk, there were kind of like, nope, don't believe it. But I'm going to tell you my aha moment where I realized that hypnosis can be a very powerful experience. We were taking our children on a cruise. My son, oldest son, was 17 at the time, and we sat and listened, watched a hypnotist performer. And my son decided he wanted to be one of the guests on the stage. Now, in my mind, I realized that my son has attention deficit disorder, hyperactivity. So I know his brain is doing this. You know what I mean? It's going and going. Well, my aha moment was through their course of progressive relaxation into the hypnotic state. My son promptly, as they were all sitting in chairs in a row on the stage, promptly put his face in the chest of the woman next to him. And at that moment, I went, oh my God, my son is hypnotized. And it really opened my mind to that possibility of how that can affect how we as people perceive what is going on in our environment. And so hooking up with a hypnotist or somebody, a behavioral therapist who's well versed in hypnotism, they can actually train you, do self-hypnosis so that you can actually do it yourself. In fact, they did a small study in a Colorado camp of hemophilia kids, hypnotizing kids to help them better manage their pain. So you'll see it was first done in 1967 where they first talk about it, but it was 75 that it was reported that by Labat that they were able to reduce the amount of transfused products as well as reduce pain. Again, a couple of kids in their 1977, you see kids starting as young as 3 years of age to help them, redirect their thought processes. Again, 86, and then in 1992. So a lot of just case studies, but I still think that there's opportunities here, just as I had seen in my own son. But you'll notice in 1992, again, another case study where again, young children up to 19 was the oldest, where they were able to have some reduction of bleeding. But it wasn't until 2021 where they actually did a randomized controlled study. So that brings a little bit more strength. 20 is not a big group, but again, we're seeing more research, which is positive. And they felt that there was improved pain interference with normal work and perception of health status, and that they've identified that it may be a promising intervention to manage hemophilia-related pain and quality of life, and that some of the benefits lasted up to 3 months. So again, keep your mind open for the possibility of other types of therapies that might be helpful to you to manage pain, other than pills. And then in 2021, Palaretti looked at 7 hypnosis trials with hemophilia patients. So you can see there was quite a few involved, different types of study designs, but they found that all the treatments were safe. There were no major side effects, and that all promoted a sense of self-efficacy and a better self-management skill set to manage pain. So again, an opportunity for improvement. You may have heard of Buzzy Bee. There's a picture of it on the right, typically used with small children. It's a vibratory device. It's kind of like a distraction where you put it on this, either the opposing arm or the same arm, and sometimes it'll vibrate, which distracts the child, but sometimes there's ice in there too to numb it. And they've used it typically for needle sticks with children. And a lot of hemophilia treatment center nurses who work in pediatrics have reported positive uses with it, but there's not been any clinical studies done with it. And then some of you may have heard of Magic Glove, which is a type of hypnotic distraction based in meditation. Basically, it's teaching that person to imagine putting on, say, a glove to mask that particular body part and going through all the different senses as a form of distraction and hypnosis. And Bajia in 2019 presented a poster at Hemophilia where they looked at 14 patients and up to 100% had improvement in their reduction of pain. So again, opportunities here. I'd like to move on to the next section, which is manipulative and body practices. And this primarily focuses on the structures and systems of the body, such as the bones, soft tissues, the lymphatic. You see the list on the right. Again, I may have missed something, but we're going to go through some of these. Now, you've all been familiar with chiropractic practices. Currently, there's no research available specific to bleeding disorders, so I can't really make any comments on that. Reflexology was only reported back in 2013 with patients who managing symptoms of their HIV and Hep C. And this has to do with the pressure points in the foot and where they do the reflexology there. Rice, you're all familiar with it. It's very well documented in the literature. But now we're starting to talk about, is ice better versus heat? And Angela Forsyth, who is a well-known physical therapist in the hemophilia community in 2010, did report on that although the ice can help, that there was some issues that with concerns with the coagulation and hemostasis related to the tissues at hand. I don't know about you, some of you, but I know that when I've had an injury and if I put ice on it immediately after, it actually intensifies my pain. So that doesn't work for me. And I've had patients that have that same experience. So again, it's finding, is it ice that works or heat that works? You have to know what works for you. Manipulation therapy is a little bit more or along the lines of chiropractic, but it has to do with along the spine and the hips and so forth. But you'll notice with some of these studies, they talk about fascial therapy and actually looking at specific joints. So in 2018 at the top, they used manual therapy for a case study on a hemophilia patient. And they found that it was safe, but it may improve joint function and reduce pain. Donoso, Ubetta in 2020 actually did a randomized controlled study for 65 hemophilia A and B patients. And they found that manual therapy, really specifically the fascial therapy on the bleeding joint, had positive effects. And particularly on that ankle that they were looking at. And then as recently as 2021, 17 people with hemophilia A with elbow issues were randomized to manual and an exercise group. And they found that the manipulation therapy actually decreased bleed frequency and pain related to activities. So we see, again, some opportunities for different therapies other than pain medicines orally. Now, when we look at massage therapy, I don't know about you, massages can be very relaxing, but if you don't have the right massage therapist, that can actually be painful. And I think finding somebody that actually knows what they're doing and can work with you and recognize the bleeding disorder potential that could occur if they are a little bit too rough with you. And then, of course, maybe the use of making sure that you're topped up on factor or whatever your treatment regimen is might be beneficial. But Bayer in 2010 recommended massage for hemophilic athletes after a muscle bleed. And I have to tell you, one of the comments made at the last talk I just made was, oh, the two hemophilic athletes that were available in 2010. So I think that's something to keep in mind. We already talked about Jadhav in India, who used massage therapy up to 84%. And Passeri in 2019 felt that massage of the scar tissue after surgery was helpful. And then in 2021, Stromer actually identified massage being helpful for reducing pain for people with hemophilia. But again, the caveat of using factor prior to. Now, I don't know how y'all feel about acupuncture. Some people may feel similar to like the hypnosis. It was actually first reported as case studies in 81 that they felt that there was some reduction. And then again in 2002, there was some another case report that reduced pain. Dr. Walney actually in 2006 did up to 12 patients and 10 out of 12 had no procedural bleeding. And then but also keep in mind that Kasayua in 2008 reported the use of acupuncture, but the patient developed an ileal psoas hematoma despite having adequate cell factor replacement. So there are still some risks there, but we're not done, because I did have my aha moment with acupuncture in that I had the opportunity to go to China many years ago And I witnessed them doing minor surgical procedures, and acupuncture was the only use of pain management that they used. So there was nothing else. There was no anesthesia, there was no topical, there was no numbing or anything other than acupuncture. And so that was my aha moment, where I came back and I selected a few hemophilia patients and said, hey, how would you like to try acupuncture? And I saw some really good results, very positive, sometimes within the first 1 or 2 attempts. But we did try to do a more clinical trial where we did have 9 patients. 6 were from the US and 3 were from India. We gave factor prior to, but India did not have factor, and that was our twin at the time. But 7 out of 9 out of the whole group reported improvement in their pain and quality of life, and we did not have any bleeding or bruising as a result. And then more recently, a study or a case report in 2014, where a type 3 von Willebrand with chronic migraines successfully used acupuncture to improve the migraine pain. You may be familiar with TENS. That's a transcutaneous electrical nerve stimulator. I've used this on some of my patients in the past. I've had good results, and in some cases I've had where it didn't work at all. I've used it on myself with some results as well. It has to do with the nerve I think there's a distraction and a stimulation of the nerve that's going on concurrently. But you can actually pick these up at most drugstores right now. They used to only be available by prescription. First used in 1985, that 36 hemophilia patients used it, and at least 50% reported some pain relief. 2018, they reported that there could be some benefit. And then in 2020, they actually had a randomized controlled study using acupuncture versus TENS, looking at pain and quality of life and joint function. And they found that acupuncture was effective over TENS. So that doesn't mean that TENS isn't worthwhile. I just think, again, it's the patient that can be, what can the patient work with, that it might work for them, might not work for them. You don't know until you try. I don't think I need to go through hydrotherapy much. It's been well documented for arthropathy and joint surgery, and getting into a pool and doing exercises or swimming is beneficial for everyone. Again, I don't think I need to spend too much time on physical therapy. It's well documented that it improves range of motion and decreases pain. We need to be more engaged in using physical therapy. And then as well, braces are well documented for the right situation at the right time with the right patient to help reduce pain. So in 2020, McLaughlin looked at a literature review to look at the current evidence of physical therapy interventions with people with hemophilia on pain and quality of life. And what they came up with, and this is pretty general, is that there's no clear demonstration for manual therapy and exercise over education and home exercises. What does that mean? Well, exercises are good, depending, but they're thinking that education and home might be a little bit better. Pool therapy has a very positive effect, more so than land-based exercises, but I think a combination is always good. And that there's no clear benefit for on pain intensity when we're looking at mobilization and exercise with manual therapy and exercise. So again, what this is telling me when I look at this is that the right patient for the right therapy can help reduce the right amount of pain. I'd like to talk a little bit about natural products, and we could go for a whole hour on this, but I've only got a few minutes, so I'm going to try to hit the highlights. So typically when we talk about natural products, we're talking about vitamins, herbals, essential oils, aromatherapy, which you may have heard of. These are found in nature. They have anti-inflammatory qualities. They can be taken orally, topically, as an essential oil, or even can be inhaled, such as aromatherapy. But I want you to be aware that it's not closely FDA monitored. And you'll see there's some other issues that have come up. I'm going to talk a little bit about vitamins only because it's part of the herbal classification. There's no studies that were done with bleeding disorders per se, but I thought there was some interesting information that I wanted to review. So vitamin C, known as ascorbic acid, it's a water-soluble vitamin. What this means is you can take as much as you want and you pee out the rest, which means you can have some very expensive pee if you take a lot of vitamin C. But they feel that that it's vital to some metabolic pathways, and it also helps with stress and pain perception. There are some clinical trials that has shown that vitamin C or ascorbic acid has proven to be safe and effective in acute and cancer and non-cancer pain relief and helpful in fibromyalgia. Now, I don't think there's any issues with increased bleeding risk in that relationship. Now, vitamin D, I want you to be aware of, is a fat-soluble vitamin. What does that mean? Is you can take too much and it can be toxic to you. And there are descriptions of toxic effects for taking unrestricted amounts. Now, personally, I think everybody who, they've done such a good job of telling us to protect ourselves from the sun for skin cancer that we have now all become low in vitamin D. But they do feel that there's anti-inflammatory effects, that in some observational studies, they found that people who had low vitamin D levels also had increased pain and higher opioid doses. And they found, there was one study where they found that vitamin D supplementation on cancer pain or muscular pain was helpful, but only because they had low levels to begin with. But then you'll see on the bottom bullet in 2019, they found no difference. So if you're going to be considering vitamin D as a supplement for yourself, either to manage pain or even make sure that you have enough for bone health, you need to have your levels measured, and then you need to have them measured with the once you're on therapy to maintain that optimal therapy, because you don't want to take too much. There are side effects as a result. Vitamin E is also another fat soluble, meaning you can take too much, known as fish oil. It has been documented to be helpful in reducing female menstrual pain, although a study done in 2020 found no difference, but there are some recommendations against using it. I do know that in some reports that there can be increased bleeding risk with it. And B12 vitamin is another fat soluble where it can be too much accumulate. And they, in general pain conditions, there has been some help related to it. But as I mentioned, no research on people with bleeding disorders at this time. Well, isn't this a list of herbal products that are out there that suggest that they can help reduce pain and have anti-inflammatory properties? You can see it's a really big list, and you'll notice down on the bottom left, I have cannabis list there because it is considered a herb right now. The thing is that every one of these has the potential, but it can be unique in different individuals. And I cannot tell you at this time which one might have the greatest bleeding risk. So if you're going to consider any of these particular issues, one of the things you need to consider is the cost, because insurance doesn't cover it, but also the bleed risk. So you need to have a conversation with your healthcare provider. And I'll just give you a quick example. I had one particular patient who liked to eat chili peppers, and chili peppers contains capsaicin. And he would tell me that if he ate a lot of them, and I'm talking all throughout the day, he felt that he had improved pain as a result of it. Well, all I could think of is I know what my stomach would have been like, but he didn't have that problem. So we had the conversation. It seemed to be a low risk for him. He felt it was helpful. It didn't increase his bleeding. He wasn't having GI issues. So we said, all right, fine. Continue to take it if it helps with your pain. So this is the kind of thing to think about with some of these herbal products that might be out there. But again, not FDA regulated, so you never quite know if you're getting exactly what you're getting. And then again, the drug-drug interaction. So you need to really talk with your provider and be open about, hey, I want to ask you about this, so that the research can be done and you can, consider that as an option if that's an area you wish to explore. So there was a review of dietary muscle supplements, particularly for muscular joint pain, and this was done in 2019, and this was for general population. And you'll notice that they conditionally recommended some of their benefits, and you'll see the list there: capsaicin, curcuma, which is like turmeric, ginger, glucosamine, melatonin, vitamin D, and such. Against recommended use is listed there. And then they had no recommendations were made for some of the others, I think because the literature is not available as much for it. But there was a mixed research review of herbals in people with bleeding disorders, and they did do a mixed evidence regarding their efficacy for pain therapy, and they reviewed in a large Cochrane use, where they overall tell you that the plant-based medicines, such as herbals, they don't recommend or advise against. But they did feel that the body of sufficient evidence was well established, or at least a traditional use of it based on the listed four: devil's claw, willow bark, frankincense, and comfrey root. And then, of course, the side effects and interaction are listed, some that should be of concern, listed below, such as garlic and ginkgo biloba rather, which can affect the platelets. So again, this is why we have discussions with our treatment center providers to go through what might be at risk and what might be safe. I'm not going to talk about cannabis. I'm sorry, I forgot to delete this slide. Other than I wanted to share with you that there's been a recent change and that it has been approved and to be taken off the Schedule 1 drug list, which means it might be more available for clinical use as well as research use, but it still has to pass the Senate, and all other things to keep in mind that this removes the FDA, what's the word I want to use? Federal law versus state laws. So it removes the federal law contingency, so it allows the states to do their own thing. But you need to be aware that when you're crossing states, some states approve cannabis, some do not. And I also recommend safety use of it. Oh, I guess I deleted it and it didn't delete. So I'm just going to go through it since I seem to have a few minutes. So first brought up in the 1850s, and then in 37, the federal law decided to criminalize it, and then it was part of the Controlled Substance Act in 1970. And then, of course, California, who's always ahead of the game, first was able to legalize it in 96. Colorado was the first to have dispensaries. You may not realize this, but in 2016, the FDA approved a marijuana-based drug called Epidiolex that was used specifically for pediatric populations and seizures. Now hemp is being legalized, and then, of course, they're now starting to put money towards research and pain in 2019. 20, they're working on decriminalizing, and this is the most recent, April of 20 to this year, where they are removing it from the Controlled Substance Act, allowing the states to do their own, but we're waiting for the Senate to pass. So hopefully we'll see some changes. These are the states that are legal, which is in the purple. Illegal, there are still 2 states holding out. And then medical marijuana is legal in the pale purple and CBD only in the pink. So keep that in mind. There are 2 types of medicinal cannabis. There's the indica, which is the highest THC content. That's tetrahydrocannabidiol. That's the one that gives you the high. And now that they have over 600 strains, and with the research that they're doing, that it actually has the highest THC content that they've ever seen. So if you're looking at considering cannabis as a product, you need to know how much THC is it, what the milligram dosage is, so that you don't take too much. And then the sativa plant is really the hemp. This is classified as a food, and this was decriminalized, and this has less than THC of 0.3. This is typically where most of the topicals come from, and it's used for medicinal purposes, but again, there's no research in people with bleeding disorders. There are several types of administration. Inhalation does have one of the most rapid absorptions, but I've always been not a fan of it because anything that we inhale, even cigarettes, can get into the lungs and scar our lungs, and I think that cannabis is no exception. The other thing that we have to think about with cannabis is there other things that are in it, like fungus and minerals or that might affect your lungs. Topical is typically the CBD with the smallest amount of THC. Oral ingestion, there's edibles. I'm not a fan of gummies because I don't think this should look like a candy for a child. And then, of course, if you're thinking of cookies or brownies, they need to be, put away in a safe place so nobody can get at them. Again, it's longer acting because of the digestive system that has a lot of availability on how it works through your system. I also have a story related to this, and you can probably appreciate this. I had a sister that wanted to take some cannabis to help her sleep, and her young son said, "Oh, I have some cannabis butter you can use." So she made some brownies, and my first question would be, is anybody, how much THC is in the butter? Which would be the first question. And then, of course, once she baked it, how big a piece did she take? How long did she wait before she tried another? Because we just talked about how it affects, the effects in the GI system. Needless to say, she didn't know any of this and took several pieces and ended up circling the toilet with her arms. And basically, I don't know if she's gone back to it, but I specifically said to her, there's a lot of ways that you need to do this in a much safer way. So anyways, just to review, if you're thinking about cannabis, is you really have to have an open conversation with your treatment center, need to know what the laws are within your state. And now that we're starting to see cannabis stores popping up, you need to know where the product is coming from, what their dosages are, how they're available. Is it produced in an FDA approved lab? And are they tested for contaminants such as fungus and metals? Because you don't need that. And then, of course, everything should start low and go slow, just like we do with any medicine that we give. It should always be stored safely. If you're starting something for the first time, you shouldn't work with machinery. And if you're producing your own, you need to know that there are specific state regulations about personal use and how much you can grow for your own personal use, and that you're not able to sell it. But then again, how are you as a person going to protect your plants from any mites, bugs, fungus, or metals? So things to keep in mind. And of course, no insurance covers it, so it's an expensive option as well. But I've had patients do very well on it, and I've had others not have any good effect. So again, it's a personal experience. I want to just touch on essential oils because we're hearing more about those. It's still part of the that particular chapter we're looking at right now. They're extracted from plants, looking at the scent or flavor. They feel that there's aromatic compounds that are distilled, that have been extracted and put into a carrier oil that can have properties to help reduce with pain. It is said that if the essential oils are obtained through chemical process, they're not considered true essential oils. And then also that there's no research studies currently related to people with bleeding disorder. I've seen varied studies with different cancer and non-cancer pain. And I've seen positive and no effect results for everything. So again, it's a personal experience. Aromatherapy is sort of like essential oils, only you inhale it. Generally, they feel that it improves health, mind, body, and spirit. I can tell you that Vicol in 2013 used aromatherapy to manage side effects of patients with HIV who happen to have hemophilia, and that they were studying the potential benefit for treating Hep C and hemophilia. But again, no specific studies have been published. Let's close up with energy therapies, and we're almost done. I'm just racing through here. I know I'm giving you a lot of information. So energy therapies are really based on the belief that there's energy flowing throughout our body, that the goal is to unlock or balance that flow. It's usually applying gentle pressure or placing hands over energy fields. And you see the list on the right of potential energy therapies. Reiki is where they put like hands over the body. It's a 2012, the Hemophilia of Georgia reported in a blog that they used it for a person with hemophilia to manage pain after a car accident. There was a case study of therapeutic touch, but it was specifically to manage side effects of hepatitis C treatment with a person with hemophilia, but no official studies are out there. In color therapy and polarity therapy, there's no studies. And I started to say nothing with magnet therapy and light therapy, but lo and behold, in 2015, a random control study was done with 30 boys with moderate hemophilia, and they looked at exercise group, laser, and electromagnetic therapy, and they found that the laser light therapy was improved more so than the electromagnetic therapy for managing hemofibrosis related problems in children with hemophilia. Small study, but at least somebody's doing it. I think that's what we need to do. And then in our national pain study, we reported at least 30% of people that use prayer as a form of management of their pain. I just want to touch briefly on topical therapies because I think that we need to do more with that. There's 3 classifications. Non-steroidals, which typically if you're taking an oral non-steroidal such as aspirin, ibuprofen, Motrin, Aleve, those kinds of things, Celebrex. If you take it orally, you have a higher level in your body than you do if you apply it topically. Are you still there? Because I see it, my screen froze.
We are still here. Can you hear us?
All right. Anyway,
you are frozen, but you look great.
Yeah, with my mouth open, but we'll keep going.
No, it's closed.
All right.
Well, kind of open.
At least you can hear me.
You're fine.
There are some topicals out there. Things like Voltaren, Flexor Patch are different suggestions. And I have used it for some patients, and I have found that this is been helpful for others. So again, it's a personal experience. There are other types, counter irritants that have capsaicin or menthol. You've seen them, BioFreeze and Icy Hot. I've had good experiences with it. I've had others where it doesn't work at all. And then local anesthetics, which such as lidocaine. So you'll see like a Bengay or a Lidoderm ointment or patch. I've had some good results and also no effect with other patients. So again, it's a personal experience. So I have given you a multitude of options other than pain pills on how you could manage your pain. And I need you to understand that it is a very personal journey and that your personal pain experience is not the same as anyone else's. And that what works for you may not work for somebody else, or what doesn't work for somebody else may work for you. So what you need to be aware of is that there are other options out there and that we don't have to use pills for everything and that we have other therapies that you can try, and you have to open your mind to different options. But keep in mind that there are some limited research in the area, but they are progressing, and that if there's some research studies that come up, you consider participating them in and helping everybody out. And then, of course, balance that risk benefit, particularly your bleeding risk if you're going to consider an option. Always discuss what you're doing with your treatment center so they're well informed and can advise you in the best way. And also consider that if you are going to try some of these therapies, many of these people, such as acupuncturists, massage therapists, they're all regulated. They all have to take, classes, and they all have to be licensed. That you find the right people for the right job and that understand your particular condition so that they can minimize any potential risk. With that, I am ending this. And if you have any additional questions, I'd be open to that. Or if you want to email me any questions, I'll be more than happy to answer them after the fact as well. And I see my picture comes and goes and comes and goes.
Awesome. Thank you so much, Angie.
Well, if that's the worst thing that happens is you lose my picture, we're doing okay. At least you saw the screen.
Yeah, exactly. No. We had you for like 90% of it, 95% of it.
So I guess we can't complain, but that's okay.
Yeah.
Does anyone have any questions?
Yeah, questions about anything that Angie covered? Yes.
I
Oh,
saw.
look, I'm back again.
Oh, you're back. Hey,
I'm still frozen. It's not.
that's okay.
But go ahead.
It's a good
So I
post.
saw on one of her slides, she showed for alternatives, on the vitamin or, vitamin and herb slide. You had, fish oil listed. But I'm pretty sure fish oil has been known to thin the blood. And I would be concerned about the use of it for pain with regards to, any type of bleeding disorder.
And I agree with that statement.
Do you agree?
It is
Okay.
well known. Yeah, it is well known.
Okay, that's what I just wanted to bring that up in case somebody caught it and thought, oh, maybe I'll try fish oil. Not a good idea if you have a bleeding.
Well, and I think the message here, though, is to, if you say you want to try it, is talk to your treatment center and they'll guide you and let you know that, hey, it has an increased potential for bleeding. But having said that, like, I'll give you an example, even taking Celebrex, which is considered by MASAC to be safer. I've had patients who have done well with it. I've had patients who have not done well with it. I've had patients who bled more on it and patients who had side effects. So again, it's a very personal experience. So, if somebody wanted to try fish oil and it helped relieve pain and it didn't increase bleeding, as long as your treatment center, agreed to it, it might, but you'd have to be aware of what the implications were and the risks that go with it.
Great. I have a question.
Sure.
A lot of the studies that you showed had hemophilia. Is there more for VWD and pain that's going to be looked at?
It's slowly coming along. When you think about VWD has always been an underserved bleeding disorder population, and people are recognizing that. And in fact, at our MASAC pain task force meeting, we actually pivoted our next project to focus on bleeding on von Willebrand's disease. Because we were actually going to focus on pediatrics. I still think that's an important population. I'd like to do both of it concurrently, but not everybody has as much free time as I do. So, but yes, there is more research going in, starting or thought processes in developing that particular area. It's coming.
Awesome. Any other questions? Awesome. Well, Angie, thank you so much for spending your Saturday afternoon with us. We so appreciate it. We wish you could be here in person, but we're glad
I wish I could have